A warm welcome. It's Monday the 9th of March. Thank you for tuning back in. Now I want to start off with some numbers today. And this first number here is the total number of confirmed cases globally. And what I want to remind you of, and we did start talking about this yesterday, I've got three key numbers here. 80%, that is the number of people when they become infected that will get a mild illness. 15%, that is the number of people that when infected will get a more significant illness and feel pretty ill for a while. They may need some medical support. For example, they may need oxygen therapy to maintain their oxygen saturations. 5% is the number of people that we expect when exposed to the virus to become critically ill and will need a lot of medical support to make it through the infection. If these people are not medically supported, then that's going to greatly raise the case fatality rate or the case fatality ratio. Now, if a lot of people are infected all at the same time, I don't know of any healthcare systems in the world that can cope with these kind of numbers if we're talking about a very substantial outbreak all at the same time. So decisions are going to have to be made with regards to that. Now, 20% of people may have no symptoms. Now you might think, oh, that's wonderful. People can get infected and have no symptoms, and that's great for them. But the problem is that these are asymptomatic carriers of the infection and will infect other people. So they'll go around their daily lives not knowing they're ill, but they will be shedding the virus. This is one of the reasons this virus is spreading so rapidly, and make no mistake, it is spreading rapidly. In addition to that, people are pre-symptomatic spreaders. So for 24 to 48 hours or maybe more, no one's really sure, before someone develops symptoms, before they go into one of these categories, then they're going to be shedding the virus pre-symptomatically before they get symptoms. But 20% can carry on shedding for a few days while they have the virus on board, while the immune system fights it, but they don't feel ill. Incubation period is 1 to 14 days. There is the occasional case of a longer incubation period, but most incubation periods are going to be 4, 5, 6, 7 days, that sort of range. Now, this is not a cold, it's not a runny nose. Dry cough is very often reported, not constantly, but very often reported feature. Fever, about 10% of people present with gastrointestinal symptoms, diarrhea, nausea. Achy muscles is a very common report, and undue fatigue is a very common report. So we're looking for dry cough, fever, achy muscles. They're the likely presenting features. Now, a bit of a review from various places now that have caught my attention. Now, in the United Kingdom, we have 64 more cases, taking us up to 273. We've had 3 deaths. And we have cases with no epidemiological links, indicating that community transmission is likely to occur. So remember the 3 stages of the outbreak: individual cases, clusters of cases, community spread, the 3 C's: cases, clusters, community. So it looks like we're kind of in all 3 of those, really. We've got cases, we've had a few minor clusters, but we do seem to be having community spread. Not surprising we're having community spread, because people are symptomatic. People who are asymptomatic, who don't have symptoms, can be spreading the virus. 20% of people that get infected. Also, we know that people spread the virus pre-symptomatically, as we've said. Now, I read the news on this with, I must say, incredulity. I thought, after all we've been saying for all these weeks now, and just let me tell you what's happened here. Flights from the epicentre, including Milan, given permission to land in Britain. Right, so that's one thing. Now, remember our reliable statements, these things that we can put on T-shirts or something. Global containment, global. containment now needed. We've been saying this for a few days now. This is not global containment, this is international travel. Two different things, completely different things. Tens of flights have been landing in Britain from the epicentre in North Italy. 17 from Milan alone. Flights into the UK. Now, what you'd expect is full infection control teams to meet them at the airport, people to be taken into quarantine, significant amounts of testing, full health screening, of course, and all the containment measures that are necessary as the local response to the global containment we now need. That's what you would expect from an advanced country like mine. What we got was people walking through customs, no medical checks, no information given. You just walk through as if it was any other Sunday afternoon. Not exactly proactivity. In fact, not even reactivity. It even falls below this reliable saying. Doesn't even reach the reactivity stage. Quite incredible. The UK government reassures us checks at airports are not necessary. Airline crew are monitoring passengers in flight. Right, okay, all respect to the airline crew, they do a great job. But I've been in professional healthcare for over 40 years now, and I can't recognise someone who's carrying a COVID-19 virus. So how we expect airline crew to do that is somewhat beyond my ability to understand. I'm sorry, I'm just stunned. I'm just stunned by what my government has said here. I'm just stunned. They go on to say evidence is clear, temperature checks are not effective. Now, I agree with that because of the asymptomatic and the pre-symptomatic spread. And instead, we're reassured we have clinically informed, evidence-driven approach to identify those at risk and take necessary actions to keep the public safe. That sounds really good, doesn't it? But there's a bit of a gap here between that which is said and that which is done. These people just waltzed in through the airports, no checks, coming from the epicentre. Public Health England has advised them, all of these people, to self-isolate for 2 weeks. They have advised them to self-isolate for 2 weeks, whether they have symptoms or not, which is good advice. Will people follow it, is my question. I suspect now, it's Monday morning, there's people back at work who flew in from Italy yesterday. I suspect some of those are asymptomatic carriers. I suspect some of those are pre-symptomatic infection spreaders. This is the current state of affairs in my country. Italy announcement started right when Italy said they were going to close these areas off. There was a big scramble and everyone thought, "Oh, I better go before I get stuck." So there's a mass exodus, and Italy facilitated this by carrying on with train and aeroplane services. So what I was commending Italy for yesterday as good proactivity has actually turned into a bit of a disaster. It's just meant that people are leaving or have left that area as soon as they possibly could. Thereby, I rather suspect, and you might suspect, spreading the infection to other parts of the world, other parts of Italy, and indeed to my country. Now, the Foreign Office advised against all but essential travel to affected areas. Really? I mean, it's just... I'm not going to say any more on that. It's just the lack of response. Where's the proactivity? Where's the global containment? Right, the United States. Deaths increase. 45 states now able to test, which is good. But there is some community transmission, and 33 states and District of Columbia are now affected by the virus. So there's no question we've got spread in the United States. Healthcare demand is already surging. Now, I'm not aware of all the reaction to this in the United States. But I know there was a case in Oregon in a school, and Oregon state public health officials Sunday closing schools and universities should be the last resort. No more need to say anything. Even when they've got a case, they're still not closing places where this infection arose. It just don't. Then what is it about the word pandemic people don't understand? Quarantine for Grand Princess. 21 positives on that ship. Now docked in Oakland, I believe. Most people are untested. Military bases being used. Which sounds good. It sounds good. But what about all the other ones that aren't detected? Where's the other proactivity going on? Italy. Another 1,400 cases. The cases here are growing very rapidly, despite the close down measures. Hospitals are overwhelmed. Not my words. They are the words of the Italian Prime Minister. Italian hospitals are overwhelmed. Not really surprising because of these numbers, which we've known for weeks from the Chinese data. South Korea, 51 deaths, another 250 cases on Sunday, less than normal. So in the South Korea, the number of new cases is decreasing, which is excellent news. So 51 deaths in South Korea, 250 new cases on Sunday. Now this is less. And this indicates that the containment procedures in South Korea are starting to have an effect. Because this virus can only live inside living human cells. And if we block the transmission between living human cells, the number will go down. So from this, it looks like the South Koreans might be starting to get the R0, this average figure for the number of new cases that each infected person infects, down to below 1. The R0 could be going below 1 there because of their measures. And they've done very well on testing, 140,000 tests done in South Korea. And if I was being unkind, I could compare this to other countries such as the United States, who have tested less. Even in my country, well, even in my country we've tested way less. So South Korea doing very well there. Now, one fairly hopeful thing here, I calculated the death rate in South Korea yesterday at 0.7. I haven't worked this out today, but it's probably about 0.6%. So lowish death rate in South Korea, whereas we calculated the death rate in Italy yesterday at nearly 4. Very high. Now, the reason might be that the South Koreans know about many more cases because they've done many more tests. So they've picked up lots of people who have low levels of symptoms or are even asymptomatic, who are going to go on and have a mild disease and make a good recovery. So if we can find out greater numbers of people that are infected and have mild disease, then clearly that's going to bring the percentage of deaths down. So from this South Korean data, which we know is reliable, I'm becoming hopeful that the death rates are going to be down in this area here, below the estimates of the British Chief Medical Officer, who put it at about 1%, and below the estimates of the World Health Organization, who put it higher. Now, having said that, we simply don't know, but I suspect the death rate is going to end up over 1%, probably 1 to 2%. But this is hopeful. When more people are tested, the percentage of deaths seems to go down. So most people, I almost said, can look forward to a mild disease. Most people who get infected will have a mild disease, which is great. But that doesn't alter the 80, 15, 5 numbers. Now, Germany and France, both a lot of cases. Germany have banned gatherings. My government's meeting today to decide if stricter measures are necessary. I do hope so. Advanced Western countries, like all the European countries, the United States, Canada, we really need to get our act together on this, and so far we haven't. Now, I just want to say one. I think maybe do a couple of. Remember our reliable sayings: catch it, bin it, kill it. Hygiene. Coughs and sneezes spread diseases. Therefore, good respiratory hygiene. Regular hand washing is absolutely key. Never forget the simple things. Don't forget this other T-shirt declaration. Elbow bumps are friendly, welcoming, polite, correct, pragmatic, responsible, considerate and cool. Now, I think I'll just say one more thing at the risk of being too melodramatic, but this is an issue for everyone. Now, I've been a little harsh on governments, maybe. Well, not harsh enough, probably, but I've mentioned governments and the lack of what I see as the lack of response, or the low level of response, lower than I would like to see. But this is for us as individuals as well. So if you've come back from Italy, self-isolate for 2 weeks if you're in my country, please. This is not just about you, it's about your family, it's about your colleagues, it's about your workmates, it's about me, it's about everyone. We have to work together collectively. So it's for individuals as well as governments. And if I can just paraphrase what a great man of the past said, healthcare must be of the people, by the people, for the people.